Interface, and my name is Tembisa Machele. Welcome to it. South Africa is faced with a dichotomy. On the one hand, sex work is illegal. This means that 153,000 sex workers operate illegally under the Sexual Offences Act. These workers are a highly marginalized group with HIV prevalence among sex workers 3 to 5% higher, or 3 to 5 times higher than in the adult female population. On the other hand, there are many human rights violations that limit sex workers accessing much-needed HIV care. Now, to combat new infections in this group, government has implemented the South African National Sex Workers HIV Plan. Our guests to discuss this plan are Dr. Farid Abdullah, who is the CEO of the South African National AIDS Council and Gauteng Provincial Manager at the Sex Workers Education and Advocacy Task Force. Diane Masawe also joins us to talk about this. And remember, if you would like to, we always welcome your contributions on our social media pages. On Facebook, it's at Interface on SABC, or on Twitter at Interface on SABC, or at Tembisa Machele. And I must just, as I welcome you, tell you that if you thought the subject of sex work was, one that stimulated lots of debate, you should visit the Interface Facebook and Twitter pages, and you will see how much the debate has been raging on there. Welcome to Interface, and thank you very much for your time.
Thank you, Tembisa.
So this plan that was announced by the Deputy President has been called historic, it's been called groundbreaking. And I want to start with you, Dr. Abdullah. How is this in any way unique, this plan?
It's unique in 3 ways. One is, whereas before our program reached small numbers of sex workers, this plan will reach 70,000 sex workers. That's almost 1 in 2 sex workers. And it's with a full package of services, though, healthcare, but also care, psychosocial care for dealing with drugs, alcohol, human rights, dealing with violence and unlawful arrests. So it's a comprehensive package to reach a large number of sex
It's not
workers.
the first plan for the country, is it?
It's the first official plan launched by government. South Africa has never had an HIV plan. We've had a few programs here and there. But, it's the first time we take this on properly and seriously.
So in terms of equitable access to health services and equitable access to legal services for sex workers, what does the plan say about that?
So it basically says that we will have a system of reaching sex workers through peer educators. Diane perhaps will talk a bit more about that. She's an expert on the subject. But, when it comes to healthcare, we're talking about doing the latest things, the most innovative things in the world. So, for instance, now with this plan and the minister's announcement that he backs it, this is department policy now, a sex worker will test for HIV. If she tests negative, she can go on a prevention pill, which what we call PrEP, or pre-exposure prophylaxis. If she tests positive, she will go on immediate antiretroviral treatment. This is the best way to do treatment for sex workers in the world, I can assure you.
So let's bring you in here, Diane. Just in jest, one of the deputy ministers said we're all, in some other way, sex workers. It depends on what contract you're on. Some are on prepaid.
And some are contract.
Some are on contract. But this is a fairly serious subject, and it begs the question, how will a plan like this work in a country that has not decriminalized sex work?
I think the plan is groundbreaking, it's historic, and I think the plan has a lot of positive things. And I think it's also important to note that the Deputy President has, did speak about law reform. I think when one looks at international studies, decrim is said to be one of the strategies towards achieving, the zero HIV rates. So the plan can work, but I think for the plan to be most effective, we have to look at our law reform. We have to have decrim in place, because when sex workers are still criminalized, and sex workers still, face, violations, human rights violations, both at the hands of clients and the police, can still face stigma and discrimination because their work is still criminalized. No matter how good the plan is, we won't achieve the desired results.
So I noticed that not only in the plan, but also in our conversations and our discourse of late, we talk about sex work. There seems to be a shift, a very deliberate shift from calling these sex workers prostitutes. Why is that?
Well, as I think you answered your own question, Tembisa, which is prostitute. The word prostitute has a certain negative connotation. And, I looked at the word prostitution in the Oxford Dictionary this morning. And one interpretation is a person who sells their sex. Another interpretation are people who prostitute themselves for certain purposes, like it's generally regarded as dishonest, a self-seeking behavior. So we think a good start is to use the word sex work. It's also keeping up with the world. We can't be so behind the rest of the world, being a modern progressive society that we are.
So, Diane, there was a staggering statistic that I heard in the week that 72% of sex workers in Johannesburg alone are HIV positive.
Yes.
Now, I want to know, is that because sex workers are not educated enough around HIV and AIDS, or is it because the partners or the clients that they engage with prohibit them from using any form of protection?
I think sex workers are educated around HIV and AIDS, and I think more so in the last few years where we've had programs. I think in the past we didn't have a lot of programs. We didn't have peer-led programs. I think it's important to stress programs at work have to be peer-led. In the past we didn't have those programs.
So the question is, why is the statistic so high for Joburg?
One, I think we have to look at the migrant population. We have a lot of migrant sex workers in Joburg. Access to health for migrants is a problem because one, people are not able to access healthcare, or when people do try to access healthcare, they experience the stigma not only of being sex workers but also being migrants. I think secondly, access to condoms in some spaces is not as easy as we think it is. Sex workers have mentioned going to clinics to try and access condoms, and the sister asking, but were you not here yesterday? Were you not here last week? Why do you need so many condoms?
Right.
And I think thirdly, clients can be problematic. I think some clients don't want to use condoms. And there's also the violence that's linked to sex work. If a client becomes violent and doesn't want to use a condom, the likelihood of that sexual encounter being unprotected is quite high. And I think lastly, although sex workers do use condoms with their clients, we also need to look at sex workers who don't use condoms with their regular clients, with their regular partners. And we know already, women negotiating condom usage with their partners is a problem.
We're going to talk a little bit more about that, but we have to take a short break. So when we come back, I'm going to take some of the thoughts that you've put towards us on Facebook and on Twitter, and to keep them coming. Welcome back. We're talking about what has been called the oldest profession in the world, and that is sex work. And we're talking about a plan that's just been unveiled to help sex workers deal with HIV and AIDS. And my guests are Dr. Farid Abdullah, who is the CEO at the South African National AIDS Council. And we're also joined by Gauteng Provincial Manager at the Sex Workers Education and Advocacy Task Force, Diane Masawe. And of course, we have your thoughts coming through on Facebook and on Twitter, and we will be getting to those very shortly. But I just wanted to ask, Diane, has there been any buy-in, proper buy-in from sex workers for this plan? Because it's one thing for government to say, here's a beautiful plan, and it's quite another for it to be implemented.
I think the beauty with this plan is it was done in consultation with sex workers. Sex workers have a motto, nothing about us without us. So I think the plan was co-chaired, if I can say that, by Farid and Nosipo Vidima, who is a sex worker and an advocacy and an activist. The sex work sector at the national level also assisted in a number of organizations who work with sex workers. So sex workers do buy into the plan, and even at the launch on Friday, there were a number of sex workers who applauded the plan. So there is buy-in from sex workers in terms of this plan.
One of the things that the Deputy President spoke about was the fact that you would have the Department of Health rolling out condoms and giving sex workers condoms, and then you have the police confiscating them because there's just no, kind of synergy between what happens in the one department and the other. What does this plan say about that?
Well, this plan says two things. One, that whereas sex workers use condoms with their clients, 75% of sex workers are using condoms with their clients. The target is to go to 95%. So it should be rare that a client and a sex worker don't use a condom. And both for the sex worker and the client, that's good. But it also talks about working with the police, sensitizing them to the fact that in the era of HIV, you can't take somebody's condoms away. That is like the thing which protects the client and the sex worker. So that's where it brings these two things together. And we'll be working with SABC. There have been a few stations where there's been this sensitization program, and knowledgeable police have been responding positively to this.
We've been talking also about ARVs in the week, and sex workers accessing ARVs. If you want to really ensure that they do access these ARVs, why not have like a vaginal ARV that's not going to, put them into some or other kind of, or open them to any kind of abuse, and they can take control of that? Why is that not happening?
Well, we would have loved to have a vaginal ring, and in fact, just a few weeks ago, the studies the trials that tested the vaginal ring showed that it was efficacious, but it was only 31% effective. But what we have in this plan is even more effective, which is sex workers who test positive are immediately put on antiretrovirals. When they are on antiretrovirals, within a few months, they are non-infectious. The risk of them transmitting the virus to their clients or their partners is reduced by 95%. So that's the road down which we've gone. The Department of Health and the Minister of Health have set a target of 90, 90, 90 for treatment, and we want to start with the sex worker population.
Let's look at who is in this sex work industry. I'll call it that for now, for lack of a better word, because there is the one view that says these are poor women and men that turn to this because they have no choice. On the other hand, you have the view that this is a highly lucrative business that women are choosing, men and women are choosing to go into, and they're earning 3 to 5 times more than what they would earn in a regular job. Who is in this industry?
I mean, the industry is quite diverse. There is an indoor sector and an outdoor sector, and the different sectors operate very differently, and the earning potentials are also quite different. So in terms of the outdoor sector, you have predominantly women who are working either in taverns, brothels, or who stand on the side of the road. And some people might say that, their level of education is slightly lower, and so the options in terms of employability is also quite low. And so for them, the choice is made from a limited selection of choices. Whereas your indoor sector, you have predominantly women who are slightly more educated, who have got a lot more choices, but people still choose...
Those that have traditionally been called high-class prostitutes,
high-class sex workers, yes. And so it's quite diverse. But I think it's important to know that it's still women and men and transgender people who make a choice to do sex work. For some people, it's because they can't find any other work. So it's short-time employment while they look for other work. And for other people, this is the career that they want to go into.
So where are we then on the discussion around decriminalizing this kind of work?
Well, once again, Diane's the expert, but if I could just kick it off by saying that government has asked the Law Reform Commission to look at the Sexual Offences Act. And they have been looking at this act, I must say, and looking, because it's 6 years since we've heard from them.
Yes.
But our information is that they have completed a report. That report goes to the Minister of Justice. and the Deputy Minister of Justice, who is very engaged on this issue, I must say, and they will take recommendations to Cabinet.
Okay.
So there's a formal process within government to look at changes to the Sexual Offences Act, and if government, and here I mean the Cabinet, feels there should be changes, they will take draft legislation to Parliament.
Diane, it's not just, the regular man or woman on the street that has very strong feelings about this. The Coalition Against Trafficking in Women wrote that support for the decriminalization of sex work will in effect support a system of gender apartheid in which one category of women may gain protection from sexual violence and sexual harassment and be offered economic and educational opportunities, while another category of women whose lives are shaped by absence of choice are instead set apart for consumption by men for the profit of their pimps, traffickers and brothel owners. What do you say to that?
I highly disagree with those views. And I think when one looks at even at international organizations who have supported decrim, it's not to say, we want to segregate women and put, some women above other women. It's to say that people are engaging in the sex work industry, both women, men and transgender individuals. And it's to say, as a society, how best do we respond to people who've made this decision? Whether you agree or you disagree with the choice people have made, one has to respect the choice someone has made and to say, how do we ensure that people who have decided to engage in sex work have got, protections? When one thinks about, whether we have decrim or we don't, the industry is still there. I can give an example. South Africa's sex work has been criminalized for the longest time. The industry hasn't gone anywhere. But what we have seen is we've seen increased human rights violations of sex workers. I think globally, sex workers are 6 times more likely, stand a 6 times more likely chance of being killed than people in the average population. In South Africa, we have sex workers who are killed, who are mutilated almost on a monthly basis.
And how would this plan protect them?
This particular plan protects because one, through a peer-led program, you have sex workers who are peer educators who will go out to other sex workers and educate them not only on health but also their human rights. You also have, if you have a police force that's sensitized, you have sex workers who know should anything happen to them, they can actually go and report. So although the plan doesn't call for decrim, it does go some way in ensuring that sex workers have got options in terms of should anything happen to them.
Okay, I want to ask when you come back from the break, why doesn't the plan boldly call for the decrim? Why is it in some muted form? But let's talk about that right after this. Stay with us. So obviously, unfortunately, we're not going to have enough time to go through absolutely every comment that has come through on our Facebook and our Twitter feeds, but I will take 1 or 2 of them. Aldine Zakaria says, trust them, meaning government, to use their energy on such an issue instead of coming up or doing something about our economic growth. And Zamuguhle Dlamini says, South Africa consists of religious and traditional societies, but the stance they take on issues related to these is shocking. If you're a parent and your child starts to behave in a way that you don't condone, don't let that be the rule. Okay, and then he goes on and on and on. I'm not sure what the point was there. And some of them are also just saying this move to try and protect and deal with sex workers in this way is disgusting. It's not right. It comes from the devil. This is not what God wants. And on the comments go. And one particular one says, and I'm looking for that one now. Yes, it's from Alvin Allens, who says, let Mr. Ramaphosa first allow his daughter to work as a formal sex worker, then we can believe his sentiments. And then Becky Njangase says, willing buyer, willing seller, finish and clear. So there's a lot that's coming up. But the general sentiment is, you know, we are in predominantly a traditional, cultural and religious society, and this kind of thing, sex work, is not seen as work, and anybody that tries to get it to be seen as work is seen as going against what the values of the society are. What would you say to that?
So let's make it absolutely clear. This plan is not encouraging sex work. It does not promote sex work. It's not saying to any woman, go and do this work. In addition, if there is any human trafficking, the plan is absolutely clear. We must remove this problem root and branch from our society. Human trafficking is one of the worst, most egregious violations of the human condition that we have come across. And the people who traffic women for sex should face the full might of the law. We should do everything we can. But we are the country with the biggest HIV problem in the world. And 6 to 10% of all our HIV is related to sex work. And as a doctor, and as the National AIDS Council, and as the government, the Minister of Health, the Deputy President, we're saying we can't ignore this problem. That's our short story. We have to deal with the HIV problem. We have to deal with the reality that there is a big sex industry out there, and not pretend that it doesn't exist.
That's a very important point that you make, because there's a fine line, isn't there, between what we see as sex work and the trafficking, the human trafficking, because when we start to talk about decriminalizing sex work, how do we then protect the very same women from being trafficked legally, almost?
I mean, I think we need to look at a country like New Zealand where sex work is decriminalized. And when one looks at research done with sex workers in New Zealand, trafficking has not increased. And yes, New Zealand is a different country to South Africa, seeing that it's an island and we're not an island.
Right.
But I think once sex work is decriminalized, things like trafficking will actually be easier to spot. One, you know, businesses will be registered. So as a business owner, a brothel owner, you're going to have to let the state know who are your employees in that particular space. Clients are also very useful informants, because clients are the ones who are buying services. Clients are going into some of the spaces that even us as an organization don't get to go into. So clients can then come forward and say, without fearing that they're going to be prosecuted, saying, you know, I've either seen, you know, underage people, I've seen women who might be forced, but also sex workers themselves will be able to come forward and speak about such things. Currently, because it's criminalized, sex workers cannot be used as informants. One, because they risk being prosecuted, but also because there are limited spaces for them to work in a safe environment. We cannot use them for that.
Is there a concerted effort within this space to educate the clients themselves to say, you know what, HIV and AIDS are very real, and you need to be part of the protection of not only these sex workers, but yourself as well as a client? Is there any of that happening?
So once again, this is an essential part of the plan. And the sort of messages we are giving to clients of sex workers, one is that if you go to a sex worker, you know, use a condom, because it's protective for you and for the sex worker, for pregnancy, for a sexually transmitted infection, for HIV, you know. Second thing is that we also are very concerned about the high degree of assaults by clients on sex workers. We also want to do a lot of education about drinking yourself till you can't walk in a tavern, and then, you know, going to a sex worker. It's all about getting the balance of these things right. From the South African National AIDS Council point of view, we're trying to introduce safer sex behaviors, and that involves many things. But, you know, if we ignore this problem, we're not doing our job.
Right, right. And the study shows that there's a high infection rate amongst 16 to 24-year-olds. Now, how will the plan itself, you know, try and be customized to cater to that particular target market?
I think it's important to note that, and I think here as an organization, and Farid can speak about the plan, is as an organization we don't work with anybody under the age of 18 because we don't believe they should be working in the industry or they should be doing work, period. But I think in terms of the plan, because the plan is peer-led and because PrEP has also been introduced, because we know that a lot of sex workers get infected when they're still young. We know when they first start the industry, one, because they're much younger, they haven't learned how to control their clients. Some don't have that much information about HIV and AIDS because they haven't been involved in a lot of HIV programming. Whereas, as they get older and they get involved in movements like Sisonke, with organizations who educate them about their sexual and reproductive health rights, sex workers become a lot more assertive with their clients. So the plan will address that, I think, because it will be a sex worker-led program. The number of sex workers who will be reached will be about 70,000 throughout. So a lot more sex workers will know about their rights, and as a result, there'll be less infection.
Well, unfortunately, that's all the time we've got for this discussion today, but I'm pretty sure that we will be continuing to talk about this. And the most important point that you made about education goes right across society to try and get us all to understand what the intention is behind this plan and what is being done here. But thank you very much for coming through to talk to us about this.
Thank you, Tembisa.
And thank you very much for all of your comments, all of your thoughts on social media. Let's keep the conversation, as always, going on our Facebook and Twitter pages. For now, it's good night.